Assalamu alaikum. Good day, everyone. I'm by name Specialties, a trainer at Elmway Academy. At this moment, we are going to discuss on the basic concepts in prevention and health promotion. Before then, I wish to welcome you to Elmway Online Academy. It's your ultimate destination for achieving your professional excellence in your career. Our academy is dedicated to providing a top-tier educational resource and training program designed to help you succeed in your professional exams on the first attempt. And whether you are aiming to pass any professional exams or we are here to support you to make up with that professional exams. At Elmway, we are exams experts. Our mission is to empower professionals by providing them with the knowledge, skills, and confidence needed to excel in their careers. The part of the courses we've covered at Elmway, it includes the SNLE Enhanced course. That's the Saudi Nursing Licensing Examination. And this SNLE, the primary aim of this course is to equip nurses with knowledge and skills that is necessary for them to pass the examination on their first attempt. And this comprehensive course is designed to provide you with a thorough understanding of the exam content, the structure, and the strategies needed for you to succeed in your SNLE examination. At Elmway, we ensure the global nurses that are willing to work within the Kingdom of Saudi Arabia, they should be exposed with the test-taking strategies and integrating the three most important components for them to excel in their examination in first attempt. Part of what we do at Elmway is we integrate the student or the nurses test-taking strategies to see how do they take this test and how do they eliminate the wrong answer and how do they affirm the right answer. And we also integrate their nursing knowledge, the knowledge that you acquire during your nursing programs. We try to integrate it with the test-taking strategies alongside with your clinical experience. Because in nursing, when taking care of the patients, these are what matters. You integrate those three things and you'll be able to make off with your examination in the first attempt. And this is our hope and wish at the Elmway. If you have the same thinking that you want to pass your SNLE examination in first attempt, think of Elmway for your enhanced course for the SNLE examination. Part of what I said we are going to discuss today or this moment is prevention and health promotion. Looking at the focus of the global health today, the dimension is moving towards disease prevention and health promotion rather than curative and rehabilitative. The focus is to prevent the disease from occurring. So we are going to look at the concept of disease prevention and health promotion. Prevention and health promotion are essential components of healthcare, focusing on maintaining and improving the well-being of individuals, communities, and population as well. And effective prevention and health promotion strategies can help to reduce the burden of disease and improve the quality of life and enhance the overall health outcome of the entire community. In today's world that we have a rapidly changing healthcare landscape, understanding the fundamental concept and the principles of prevention and the health promotion is crucial for the healthcare professionals themselves, as well to the policymakers and the community leaders, because in the aspect of health promotion or disease prevention and health promotion, we unite the community, and in community mental health nursing, in community health nursing, we look at community as a client. So our client in community or public health, we look at the individual, we look at family, and we look at the society or the community as well. Disease prevention is of 4 stages. The first stage is primordial, second stage primary, third stage secondary, and fourth stage tertiary. Looking at it from the primordial point of view, the aim and target of disease prevention is to modify the social determinants, our day-to-day interaction with the causes of the disease. So what we are doing under primordial prevention is to address those problems that we come in contact with them in our day-to-day life, looking for what to eat, in the cost of our business, in the cost of our occupation. We have been exposed to some one aspect of disease or the other. So what we are doing under primordial prevention is to modify those social determinants. And at primary prevention, the focus is to limit the exposure that lead to the disease. If you look at the target now is to address the risks and protective factors. So we are concerned with the individual at risk under the primary prevention, or we are concerned with individual. Well, in primordial, we concern with the entire society or the entire people within a profession. And in secondary prevention, we try to dictate and treat the pathological processes earlier, and when intervention can be more effective. And the concern here, what present here is preclinical pace. Maybe an individual, due to the day-to-day business or due to the health illness continuum, an individual may come with some problems in one way or the other. So our major concern in the secondary prevention is thorough screening to identify the problem earlier, so that we bring the intervention earlier to prevent an individual from becoming deformed or from causing deformity to an individual. And at the tertiary prevention, we try to modify the risk factors and the pathological processes to avoid relapse or further deterioration of the disease. If you look at the major concern or the major concern of the tertiary prevention is to what? Is to ensure there is rehabilitation of a reversible or non-reversible health condition. Then we've tried to bring an individual. If it is, we put all the measures. The primary measure failed, an individual, we put this, the primordial failed, primary failed, secondary failed. Now at the tertiary, we try to rehabilitate an individual that his condition is non-reversible. Then we rehabilitate an individual so that he can come back to his society and function within his own society. The target population at the primordial is the whole population. Our concern at the primordial is the entire society. Whereas at the primary, we look at the what? At the at-risk group. People that are at risk of coming down with the disease. Well, in the secondary, we've looked at the patients with the disease. That's why during the action, we've talked about early identification and front treatment. Then in the tertiary, we look at the recovering of an individual, so that how will that individual be recovered and remain productive, and he can go back to his normal business and continue with his own business. And the agencies and approach that are involved in disease prevention are including the government via the legislation and the physical measures. Government should make policies that has to do with disease prevention in the community or within that state that make policies. These policies are meant to ensure the general health of its citizens. So the public health via a community action. We also have public health as an agency. The approach involved, we give out our own via a community action. And we also have a public health via screening, particularly during our community outreaches or a mobile health services that we've gone out to look at the problem of the people in the community, to address the problem of the community as well. Then for the community agencies, we do it via the social programs and the family physicians or counseling for counseling risk factors or risk factors changes and early treatment of the disease. And all clinicians via counseling and follow-up care and rehabilitations of the individuals. Thank you very much for your time. When we meet next, feel free to drop any complaint, question, comment, contribution you have based on what we've discussed so far. And next time when we meet, we're going to look at all the levels of prevention and talk about the health promotion as well. Thank you. Have a nice time.